Hello, I'm Dr. Jensen of Restoration Dental. Many people suffer from Temporo-Mandibular Disorder, or TMD, better known in the mainstream media as TMJ. The TMJ is merely an acronym for the joint that sits in front of the ear that is one of many components affected by Temporo-Mandibular Disorder. Today I'm going to walk you through the signs and the symptoms of TMD, as well as diagnosis and treatment. Let's start with signs and symptoms. Signs are clues that can be seen clinically either inside or outside of the mouth by a dentist, which help to detect that TMD may be present. Remember, signs always precede symptoms. Worn or chipped teeth, broken restorations, loose teeth, crowded teeth, lower molars that are tipped toward the tongue, scalloping of the lateral border of the tongue, mouth breathing, presence of tori, which are areas of dense bone that show up as bumps on the bone. These are formed because the body recognizes that the bite is not right and is hitting very heavily. The body lays down more bone automatically to protect itself from this traumatic occlusion. Missing premolars due to orthodontics, and collapsed or vaulted arches. As I had mentioned earlier, signs precede symptoms, and the next phase in this downward spiral of events are symptoms of TMD. Jaw pain, facial muscle pain, clenching and grinding of teeth, neck, shoulder, and back pain, headaches and migraines, pain behind the eyes, unexplained tooth pain, clicking and popping of the jaw, numbness or tingling of the fingers, difficulty swallowing, dizziness, and ringing of the ears. Our patient presents with several of the aforementioned signs and symptoms. She had her consultation with us recently, and she has since decided to move forward with diagnostic testing and orthotic therapy or stabilization, which is referred to as Phase 1 treatment. After her bite is stabilized and she is symptom-free, she will then move into permanent or Phase 2 treatment. Phase 1 treatment begins with a comprehensive exam, a full mouth series of x-rays, transcranial x-rays of the temporo-mandibular joint, photographs, impressions, and finally tensing and a K7 workup to verify her bite. Before going any further though, let's talk about the causes of temporo-mandibular disorder. This is the most shocking aspect of TMD to most people. As you will see in this graphic, most of the causes of TMD are developmental. That's right. The way that our skeleton and airway forms as babies can dictate our future. Remember, form follows function, but form also follows dysfunction. Pretty shocking, isn't it? Let's start with the first cause of TMD. Finger and thumb sucking as infants. As you can imagine, this will help to dictate the formation and the morphology of the jaws. Finger and thumb sucking can be very detrimental to the proper development of the jaws, facial structures, and to airway development, which can then lead to TMD in adult years. Artificial feeding of infants. As we all know, breastfeeding is the best option for providing optimal nutrition to infants. Human breast milk is very high in nutrients and antibodies which help our babies' immune systems to become very powerful, which then enables them to overcome not only multiple diseases, but to fight off allergens, which we will get to in a minute. Also, the human nipple is perfectly shaped such that when an infant breastfeeds, ideal lip and jaw position take place, facilitating proper development of the jaws, facial structures, and the airway. As we all know, breastfeeding may not be an option. In fact, my own children were bottle-fed. It is very important to know that using the correct nipple when bottle feeding can help to facilitate proper development of the jaws, facial structures, and airway. This nipple is the Nook nipple, which was developed in part by the late Dr. Jim Gary, who was a pioneer of neuromuscular dentistry and the world's leading expert on airway development of infants. The Nook nipple has the closest resemblance to the human nipple and therefore helps to form the infant jaws, facial structures, and airways properly. Allergies. As mentioned earlier, breastfeeding is the best source of nutrients for our infants. One major reason being that the antibodies that it provides helps our babies to develop an immune system that can fend off allergies. I'm not saying that breastfed children don't get allergies. Sometimes it just happens no matter what. The point is, when an infant develops environmental allergies, the turbinates in the nose swell, causing nasal congestion. The tonsils and adenoids swell, causing airway obstruction, and mouth breathing then takes place. Chronic mouth breathing invariably results in malocclusion or having a bad bite because the tongue is not confined within the borders of the teeth, causing muscle imbalance, which can then cause teeth to move and or grow in incorrectly, causing a bad bite, which in turn leads to TMD. Trauma. This one is obvious and is not necessarily developmental. Trauma to any area of one's body has the potential to cause chronic, long-standing problems. As we all know, sometimes traumas can be treated with 100% healing and recovery, and sometimes they cannot. It merely depends on the patient and the situation. Overall skeletal development. Sometimes we just form incorrectly no matter what. One may be born with a syndrome or some underlying medical condition that dictates a dysfunctional skeletal development. The key to treating temporomandibular disorder is getting the muscles out of spasm and getting them relaxed and happy. To do this, we will pulse the muscles and relax them into a more natural down and forward position using a TENS unit. Once the muscles are relaxed, we will verify muscle activity using EMGs. Here you can see her muscle readings before tensing, and now here are her readings after tensing. Besides tensing, we also use computerized jaw tracking to verify that the lower jaw is on the proper trajectory in all dimensions. This scan tells us where our trajectory needs to be built to, and it is verified by the EMGs, which we will get into next. Along with jaw tracking, we use electromyography, or EMGs, to verify that the trajectory is correct and that the muscles are indeed relaxed. Again, here are some before and after EMGs. The before EMG shows very hypertonic, in spasm, hot muscles, and the after EMG shows very nice, relaxed, calm, happy muscles. Here is a graphic of a healthy temporo-mandibular joint, or TMJ. Notice the head of the condyle sits right in the center of the glenoid fossa in a down and forward position, not impinging on any structures in the area. Next is a graphic of a joint that is in a pathological position. Notice the head of the condyle is now jammed up and back against the glenoid fossa, impinging on the innervated tissue and surrounding structures. In this particular graphic, the lateral pterygoid muscle is in spasm and is pulling the articulating disc of the joint forward, which results in clicking and popping. This can be painful. The final graphic of the joint shows just how degenerated a joint can become over time if TMD is not addressed and corrected when signs are present. After verifying that her muscles are relaxed according to her EMGs, her bite is then recorded at this new relaxed position. This new relaxed position is called the neuromuscular position. Therefore, this type of dentistry is called neuromuscular dentistry. Once her impressions are poured up, they are mounted together using the new bite registration, and a mandibular repositioning appliance or orthotic is made to bring her bite into the new position, as verified earlier by the EMGs during her K7 workup. She will then wear the orthotic for 3 months to calm her muscles and therefore eliminate her symptoms. She will stabilize her new bite, and it will allow her joint to heal in the new down and forward position. After 3 months, she will then move into phase 2 treatment, which will permanently move her teeth into the new position to lock her new bite into place where the muscles are happy. This can be done one of 2 ways depending on the patient's situation. It can be done through orthodontics, which is braces to actually move the teeth into that new position, or it can be done restoratively, meaning she can have crowns placed on all the teeth to move into the new position. This is called a full mouth reconstruction. Because of this particular patient situation, she chose full mouth reconstruction. As you can see from the photographs, after having full mouth reconstruction, not only has her bite corrected into that perfect neuromuscular position, but at the same time, she achieves perfect dynamic aesthetic results too. The case turned out beautifully. She is very stable. She is very happy, not only with the way that she feels, but also with the way that she looks, as you can see. As you can imagine, dentistry such as this is life-changing. At Restoration Dental, we are an LVI-trained team offering neuromuscular dentistry with the technology in place to verify our findings. Remember this: if it can be measured, it is a fact. If it cannot be measured, it is merely an opinion. Thank you for watching our video. We greatly appreciate it, and if there's anything that we can do for you, please call us at area code 515-964-4247. We do offer free consultations. Thank you.